Hi, I'm Laura Ryan and I am an ambassador for the Trek the Trail event with the Toowoomba Hospital Foundation, and we are raising funds for the Regional Cancer Centre. I came up with the idea for Trek the Trail around August last year. I was actually diagnosed with breast cancer almost 2 years ago just now. It was an earth-shattering experience. Thankfully, the care that I got through Toowoomba Hospital was absolutely outstanding. I really felt well cared for. So based on my experience, at one point when I was really keen to get back into exercise, I did approach a programme that's available in Toowoomba for people experiencing cancer to get into exercise. Unfortunately, I was turned away from that programme because I wasn't eligible. I then scouted around different gyms and I joined a gym and I started working my backside off. As soon as I joined the gym though, I coincidentally had an appointment with the oncology physiotherapists who were horrified at how hard I had been working out because I had gone too hard too quickly, because again, the guidance and correct information and advice wasn't available to me. Early on in my diagnosis, I was given guidelines from the Clinical Oncology Society of Australia, which outlined that people experiencing cancer should return to exercise as soon as possible after diagnosis, with the minimum guidelines being 150 minutes of moderate exercise or 75 minutes of intense exercise per week, along with 2 or 3 strength training sessions per week. So throw that in around chemo, surgeries, different treatments. It's hard, and it's hard to know even where to begin. So I was given the advice that that's what I should do, but there was actually no one available to advise me of how I could actually do that. I became aware of the project for the Regional Cancer Centre. That actually really excited me. The thought of exercise and that advice being integrated into people experiencing cancer's treatment just as par for the course, I think is absolutely amazing. I think, as we know, exercise is always easier with a friend, and I have made friends along this journey. I've made friends with staff, I've made friends with other patients, so there are positive things that come out of it. But I think that if there is a gym on site and there's an exercise physiologist on site and there are people on site working out together, working out safely, then when we graduate from the hospital programme, people are more likely to continue and maintain that exercise and that level of fitness rather than give it up. The reason for those exercise guidelines is because, one, the exercise can reduce the side effects of treatment. There are also studies that show that meeting those exercise guidelines can reduce the risk of some cancers returning. But in actual fact, in Australia, the majority of people are not meeting those exercise guidelines. And it's quite understandable why, because it's not particularly what you feel like doing. And if the advice and information and the guidance isn't now out there of how you can do that safely, then it's really difficult. So now it's about 15 months since my last radiation treatment, and I'm still actually in need of an exercise physiologist. So I'm in the process of having a referral made, an assessment and referral done just now, because I have been going to the gym. I've been going to the gym religiously. Unfortunately, that ended up with me experiencing significant pain in the area where I had cancer and where I've had radiation and surgery, so much so that I could be in tears just when I'm sitting down, completely inactive and at rest. So it's really important that I speak to someone who can advise me on how to exercise safely. My oncologist did suggest that it's probably muscle inflammation between my ribs. I've also tried to do a couch to 5K over 6 months, and I still cannot run 5 kilometres. I can barely run the length of myself, which again, my oncologist advised is probably largely because the medications that I take affect the oxygen levels in my blood, making exercise more difficult. So yes, it's really important that people can get tailored advice based on the surgery that they've had, the treatments that they've had, and the ongoing medications that they're taking. If we can reduce the number of people who get that news a second time, and if we can reduce the number of times that doctors have to deliver that news a second or a third time, then there's not much better than that. Sign up for Trek the Trail, join us on August the 30th and 31st to raise $75,000 for the Regional Cancer Centre.